So we can begin by palpating. If it helps us to find our landmarks, we can find the C2 spinous process. This is going to be the first site of our percussion because we aren't going to be able to percuss deeply enough safely or with a reasonable amount of force to reach the posterior tubercle of C1, and it's so little.
Can you do that from the other side instead of the...
Find C2, press on C2, and there you are. So that's going to simply let us know the uppermost or superiormost extent of where we're going to do our percussion. From then, we simply tap down with overlapping hammer strokes all the way to the cervicothoracic junction. And it can help us if we're having difficulty identifying the location of that C2 spinous process. The patient can flex forward slightly, and that will make that tissue a little bit less deep overlying the spinous process by pulling it taut. So in any case, from here, tap, 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 tap. And by the time we reach the lower cervical spine and especially the cervicothoracic junction, we should be able to hear our taps. That should produce kind of a nice hollow thud sound. And that's what we're really looking for. So it's just kind of a wee tap, tap, tap. That's not really going to cut it. We need to convey enough force to really let us know whether or not there is a fracture present. So again, kind of remind yourself why you would be doing this test, and that can help to motivate you to apply the necessary amount of pressure or force, because this is really a test that is designed to help reveal the presence of a significant anatomical disruption in your patient. It's something that they need to know about. So again, that's how we can talk ourselves into doing this kind of pressure and not feel bad at night. So, any questions about cervical spinous percussion? And again, this is a component of our fracture screen, also an orthopedic test in its own right. Okay.
You're looking for pain, and you're looking for the absence of good thud.
So you're looking for pain, and typically the character of this pain is, as I described, an exquisite point pain. So it's not just, it kind of hurts. It's stop. There's typically some kind of a withdrawal reflex. The patient will attempt to put some distance between themselves and you, and that's a pretty good indicator that you have a high pain response on your hands. Okay.
That was the reflex.
So feel free to grab one of our illustrious